questioning. Dr. Dunn.
Thank you very much, Mr. Chairman, and thank you, Secretary Kennedy, for being with us today. I want to begin by commending you for the work your department and the administration has done to make improvements in the health of the American people and to be responsible stewards of our tax dollars. Time and time again, we heard from the prior administration mismanagement across the department, but I'm particularly concerned about the damage inflicted to public trust in our health institutions. Unsurprisingly, when faced with sweeping mandates, the American public responded with skepticism and mistrust. I know you've already taken steps to restore public trust in our health institutions. Do you see those as being successful in the near future, or over what timeline?
We're going to restore public trust, Congressman, Vice Chairman, by restoring truth. We're going to tell the truth to the American people, and we're going to use evidence-based science, gold standard science. As I said, we're going to use replication. If I can take a minute just to respond to something that Congressman Pallone said, and I'll address you, Congressman Pallone. 15 years ago, you and I met. You were at that time a champion for people who had suffered injuries from vaccines. You were very adamant about it. You were the leading member of Congress on that issue. Since then, you've accepted $2 million from pharmaceutical companies in contribution, more than any other member of this committee. And your enthusiasm for supporting the old ACIP committee, which was completely rife and pervasive with pharmaceutical conflicts, seems to be an outcome of those contributions.
Mr. Chairman, point of order. Point of order.
The chair recognizes
Point of order. The
Dr.
gentleman is impugning the reputation of a member of Congress.
Stop the clock.
Can you stop the clock for a second? Can you state the point of order?
Yeah. He was impugning Mr. Pallone's
Mr. Chairman, I didn't hear it. Did the
Oh,
gentleman?
you weren't paying attention, that's why.
Well, you know, it's hard to pay attention here when we're not getting any responses.
Okay,
My
okay.
understanding now is that the secretary said something about me taking money from pharmaceuticals? Is that what he said?
The secretary implied that Mr. Pallone would not fight for vaccine victims because he took money from the pharmaceutical industry.
You know,
He
again,
needs to take back those words.
you know,
Okay, okay, here we go, here we go, here we go.
Taken down.
This, Mr. Secretary, this is a valid point of order, I'm told. So I'd ask you if you would, please take back those words.
They're retracted.
Thank you, Mr. Secretary. Now, ladies and gentlemen, we're going to continue on with the decorum that I mentioned earlier in this hearing. And what we're going to do is to go to Dr. Dunn to finish up his time of questioning. Dr. Dunn is recognized.
Thank you very much, Mr. Chairman. So the department's fiscal year 26 proposed budget includes $750 million for strategic national stockpile as the Republican lead on the Pandemic and All Hazards Preparedness Act, PAPA, we call it. I believe that a strong national stockpile is critical to ensure we're prepared to respond to emergencies. Do you see this stockpile as being adequate, or $750 million budget being adequate for that, sir?
Well, I'm very, very gratified about congressional support for reappropriating PAPA, which is absolutely critical for our pandemic response. The stockpile, I think, has now $17 billion worth of inventory. I have to check those numbers, but I'm pretty sure that that's it. And we could be doing better. The stockpile did not distinguish itself during COVID. It didn't have many of the things that we needed during COVID, and we're doing a review of that right
Please
now
let
to
us
make
help you
sure
with
that the
that.
stockpile is adequately stocked.
Keep us informed, and we'll help you with that. Thank you, Mr. Secretary. You've long been an advocate of addressing mitochondrial health, kind of an interesting, edgy area that's illuminated earlier by the questions from Chairman Carter. The Haley VA Medical Center in Tampa has validated the compassionate use data for amyotrophic lateral sclerosis, Parkinson's disease, and has generated new positive data using mitochondrial transplantation for Alzheimer's. They've also entered into formal agreement with Walter Reed to use this, experiment with this treatment for traumatic brain injuries. And now NASA is entering into a similar agreement to study mitochondrial health issues associated with space travel. Secretary Kennedy, do you intend to continue these efforts?
To study mitochondrial?
Yes, sir.
Yeah, I mean, that's going to be, mitochondrial dysfunction is the heart and soul of the chronic disease epidemic. And, you know, we now know that Alzheimer's disease, which was once thought to be, have a number of hypotheses about its etiology. But Alzheimer's disease is now characterized in the medical literature as type 3 diabetes, because it's recognized that mitochondrial dysfunction is not just causing disease in children, but it's also causing a disease in adults. And the cause of it is clearly our food. That's one of the principal causes, and we are absolutely laser focused.
I'm afraid our time has expired, but I
Gentlemen's
thank you
time has
very much for your
expired.
answers.
The chair now